What you have in your packet is an abstract, a nice colorful chart, and the bill itself. Every school is required to participate in the federal breakfast and lunch programs. The handout you have shows you our often abysmal participation in those programs. And it's color-coded by district, so you can find your area and see whether you're not you're one of the good counties. And that kind of is the genesis for this. We've heard through our public meetings and other speakers that we've had in this committee that children are not being fed, and there may be lots of reasons that they're not being fed, or they're not being adequately fed, or they're eating junk and not having good nutrition, and then we have the problems with obesity and all the health problems that are attendant to that. As we listened to people in the community talk to us, we realized that one place that you can have an impact fairly quickly is with the school lunch and breakfast programs. If more children participated in those programs, they would have a better foundation for learning, and that is the key to the genesis of this bill and its intended consequence. You'll notice right off the bat that we are repealing one section of current code, Chapter 15, Article 5, Section 37. That section currently mandates all schools participate in the breakfast program. So we've repealed it and incorporated part of its provisions into the proposed new article. The findings and intent of the legislature are expressed through several pages of this bill. We talk about the things that we have heard and the information we've gathered in our research for the committee meetings here. If you are hungry, if you've had these stressors that we've heard about, you're not ready to learn or pay attention in school. And that's going to impact your overall performance. The relationship between poverty and childhood hunger is also pointed out in the findings. It's noted that high rates of childhood hunger and obesity are occurring because the nutrition is lacking. Even if children are eating, they're not getting a good, nutritious, balanced meal. And our research has shown that providing a balanced school breakfast may in fact help prevent the childhood obesity, or at least have a reducing effect on it. The thing to keep in mind with this bill is that the federal money is out there. It is available to reimburse counties that provide healthy breakfast and lunches. It's on a scale. If you meet a certain level of need, the meals are provided free. The federal government's 100% reimbursement. Then there's a reduced price and then a full price. Some of what we have heard is, I might be a middle-class parent, but I'm living on the edge paycheck to paycheck. I may not be able or feel I can't afford the bill from the school for the lunches. So when I'm being billed, or a collection agency for some county calls and says, you know, we need you to pay your school lunch bill for your children, I just may not have the money. So I might not meet that poverty level to be fully reimbursed for that meal in the school, but my children are going to be told, quit eating the school lunch, I can't afford it. And we're hoping to avoid that by establishing partnerships with the communities, with businesses, and with individuals, allowing them to make donations and contributions to help pay for those meals. The initiative will begin in the 2015 school year. The county boards and the state board of education, Department of Education, I'm sorry, are required to set up nonprofit funds or foundations to accept the contributions, and then as the money is gathered, the program will be phased in, starting with elementary school, to provide universal breakfast and lunch for all of the children, without regard to the parents' perceived ability to pay. If the parents can pay, they obviously can make that donation. The funds would be used initially for the school lunch and breakfast programs. But there are a lot of other innovative programs out there. Farm to school, community gardens, backpack programs that we heard about in our community meetings where volunteers are putting snacks and foods into backpacks and sending them home. Because for some children, the food they get at school is all they have. So if you're able to provide something for them after school in an after-school program or something for them to take home on weekends, the summer feeding programs, all of those things can be enhanced once you have the money from private contributions to do that. And some of those programs are funded at a very low level at the federal level, so the majority of the money is going to come from the community. The bill urges the schools and the boards and the department itself to form partnerships and to collaborate with the Department of Health and Human Services, Health and Human Resources, Department of Agriculture, other groups and folks that we've heard from that have innovative ideas and ways to help the lifestyle and improve the health of the children. Collaborate with all of them and find ways that work that you can afford in your school. What works in one school may not work in another. So they have the freedom to work out what is best for their community. The Department of Health and Human Resources is given the authority, if they need to propose a legislative rule and bring it back before the body. The funds that are collected by these nonprofit funds and foundations will be audited as part of the annual independent audit of the State Board of Education and the county boards. I've asked the Department of Education to get me the exact wording for that, so that one section might need an amendment once I hear back from them, if the bill is moved out of the committee. Thank you.
The room's not nearly as full. And it ought to be. It ought to be. I think that this bill is an absolute essential to complementing the governor's bill if we want to improve student achievement in the state of West Virginia. Let me give you the facts and the figures. Last July, I was a reluctant participant in what we know as the community eligibility option. And that's when you take certain schools and give them universal free food. And we did it mostly in our elementary schools. Our larger schools didn't qualify because of our free and reduced lunch rates. What happened in 6 short months is that we have increased our breakfast participation by 6% in Randolph County and our lunch participation by 8%. A lot of this had to do with the fact that the stigma of who got free and reduced lunch was completely gone. And those of you who've been in those lunchrooms know about that stigma that sometimes causes students not to participate, particularly as they matriculate through school. It becomes more prevalent. I'm proud to say that one of our cooks from George Ward, Miss Rella, she has an R and a W confusion when she talks. And so when Lorraine Corley, our child nutrition person, came to her and talked about CEO and talked about what she had to do and things like that, she said, "Miss LaWayne, I don't know that this is going to work." Well, Rella made it work, and this year, because of her participation gains, she was the Service Personnel Cook of the Year. And we're really proud, but she was a true doubter. But I don't want you to think that we were all Neanderthals in this approach, because Rella has always stood in the forefront of understanding the implications of poverty and the lack of food in a child's life. She's been cooking meals since the late 1960s at George Ward Elementary School. And she sees it on a day-to-day basis. This summer, in July, when we had the derecho and we had the power outages, particularly in the southern part of Randolph County, Miss Rella worked just about every minute and second of every day to feed families in southern Randolph County, and mostly the children. And somehow through this grapevine that they have out there that we all know about, because phones weren't working, she got the message out and people came in. In my attempts to help out in a time of emergency, I spent several evenings working with Miss Rella, helping to feed. It became abundantly clear to me that the only time that many of these kids would eat is when they were at school. And many of these students were in our summer intercession programs. We started the CEO program, and it has worked wonders in Randolph County. I had an epiphany. I read about that Senator Unger had an epiphany at one particular point in time, and that's what got him interested in this whole issue. I had an epiphany. My epiphany came in late October, and our community was reeling. It was reeling from the SSAC ruling at Elkins High School. It was reeling from the death of a student who was stabbed at a football game. And as we were trying to recoup and recover from those two very traumatic experiences, we had Hurricane Sandy roar through Randolph County, and it shut us down for 11 days. Part of my role as the county superintendent in that was to get our schools open as soon as we possibly could, because we had folks that were starving in Randolph County, mainly children. And how do I know this? Because on the Tuesday evening, I took a journey across 33 from Elkins to Harmon, in which the trees on the upper side of the hill were laying down on the power lines, and that was your tunnel. It was like a cave, and for those of you who have traveled that road know that what that's going to be like. The main mistake I made was my wife insisting that she wanted to travel with me. So God got me back home safely, but my wife sure gave me the dickens. When she got back, she said, "I can't believe you do things like this." Well, I went back the next night too, because there were people at the Harmon Fire Station standing wanting to be fed. When the kids got back, our cooks rather meekly came to me and said I'd go out to see how the schools were getting back and seeing if the kids in, because you got to realize, for 2.5 miles between Kearns and Parsons, that road was completely covered with pine trees. And that was the main road. It took us 11 days to get the point to where our buses could get out. We knew it was absolutely critical that we got kids back in school in Randolph County because they weren't eating. And when we got back, we had a couple of cooks said, "Dr. Ferris, I've got to tell myself we're giving seconds," which is a no-no in the world of child nutrition. Mr. Groff will probably stand up and tell you that. And I told him for the next couple of days, and I had talked to Dr. Marple and told her that, we needed to take care of these kids, and she said make sure they get robust meals, and they did. But I told the cooks that our goal for the next 2 to 3 weeks was to make sure that when lunchtime was over that our serving pans were empty. We needed to get the food to them. And they complied. But folks, when you walk into North Elementary and you see some children that don't have the wherewithal to eat whenever they're not in school, and they're licking their trays, you begin to realize how severe this is. Now, it's unfortunate that we had Hurricane Sandy to hit me in the head with the 2x4 to understand how absolutely real this is. But many of those who are out in the field and face-to-face understand this day to day. Our teachers know that when they're hungry and they're fidgety. Our teachers know how absolutely sensitive it is to get every child fed, because they'll make it all the way through the day. I also just experienced another wonderful thing when I was in Randolph County, and this isn't my idea. Well, we had a choral director at Elkins High School that came up with a book bag program. They began to realize that there were many kids that had not eaten all weekend when they got back into school. So she worked with several community churches and several community businesses, and they donated food. And finally, they started donating services to load these backpacks, because I think originally we started with about 30. And I think they're up to almost 300 book packs that we're sending home every weekend from Randolph County. And I know that other county superintendents, they get heard by word. We tried to keep it anonymous, and I kid you not, and believe this, there were people that gave criticism to us for this type of thing, that we would open up these book bags and send folks to them. So I'm in support of this bill. There is some language that probably needs to be worked out. There's nothing in it that's obtrusive to the Department of Education. We're in support of it. The only language in there that caught my eye was that in the part where it says shall promote grab and go, etc. It said shall include. I think I would put in there included but not limited to, because as I've seen this thing evolve, Senator Unger and the rest, is that schools, when given the opportunity to do this, will come up with creative ideas in order to raise their participation rate. And I wouldn't want to limit to just grab and go or breakfast after first, or I missed that third one. I should have memorized it a little bit more. But I stand here in total support of this bill, and I do so. I've been called many things over the past 2 months. Call me shameless, but I implore you, get this bill out and let's get it started. Thank you.
Thank you, Mr. Chairman, other members of this committee. First, I just want to say, first time I had a chance publicly to say, I really support this committee's efforts. Senator Unger and I, Mr. Chairman, we met 2 weeks ago, and I want to let you know from the department's perspective, everyone in my department is fully committed to work in any way they can with everyone on this committee and the efforts that you're doing. And now specifically to this bill, we recognize that nutrition and proper nutrition is a key to a successful child as a student, as they develop as an adult. So we understand that that's one of the indicators that we need to do something about. So let me start by saying I fully am supportive of this legislation as written. We believe the department can help in many ways with the outreach program for when children are not in school, whether that be summertime, weekends, holidays, snow days, or at night. We know there's some very good existing programs that the superintendent very passionately spoke about before me. We believe we're built in our structure in the county offices, we're out in the communities, that we can tie into a lot of the different community outreach, public-private partnerships to get that going. We have experts from the Bureau of Public Health that can help in regards to make sure that the right type of food gets out, hooking that up with the medical homes of the children. And so we're looking at the whole child and this as being one important component. And it's my belief, something that I'm really happy about and excited about is, you know, there's, to Senator Hall's comments earlier, and we've had this dialogue, you know, we know that the state alone can't do things, government alone can't do it. And I really appreciate the model of this legislation of a public-private partnership. Because we all, in this, I keep saying the same things over and over, but there's only 1.8 million of us, and we're in this together. We may have different ideologies, et cetera, but we can come together and work together. And I think this is a good model that we need to develop more in the social justice arena and the social services arena, this partnership. And I just want to tell you that I fervently and passionately support this. It's not just a moral imperative, which it is. It's an economic imperative to find creative ways to work with our communities, to work with our individuals and government together to ensure that our children do have a bright future. And so I'm fully supportive of this bill.
Thank you for giving me the opportunity to speak. I'm certainly in favor of this act. At the state board level, we hear quite often success stories around some of these programs where the children have breakfast in first period. And clearly anything and everything that can be done to support nutrition at that level is appreciated. And frankly, as a businessman, I also like the aspect of it that it gives business an opportunity to actively participate in the process.
Yes, thank you, Mr. Chairman and members of the committee. I appreciate the opportunity to just share a few brief comments with you. Most of you know we just finished a raging debate around our big education reform bill, Senate Bill 359, and we get in these debates about how to improve academic achievement, whether we do that through changing the hiring criteria or through more collaboration for employees, through planning period time and faculty sentences. And those are fair debates, and we debated that issue ad nauseum, or those issues. But here's an issue that defies debate: child poverty and hunger in West Virginia. Defies debate. It's here, it's real, and we can put our heads in the sand and pretend that it's not, but it is here, and it is real. There are volumes and volumes of research that says the #1 predictor of academic achievement, student academic achievement, and ultimate student success is the socioeconomic status of the child's family. Defies debate. Hungry children don't learn as well as other children. They don't. They simply don't. And it's not just hunger in the traditional sense. It's food insecurity, where they may not, Senator, be hungry that day, but there's food insecurity in their home. They don't know how they're going to eat over the weekend. So I applaud the efforts of this committee in this piece of legislation. I think this will prove to be one of the most important pieces of legislation that comes out of the legislature this year. We ought to take a look as well, and I know Dr. Ferris spoke about this. I can tell you that working with our school cooks over the years, we serve more food on Mondays and Fridays. People come to school very hungry on Monday, and when they go home on Friday, they, for lack of a better description, they tank up to go home for the weekend. But we do have some policies in place, and I know that they're driven in large part by the health department, that causes us to throw a lot of food away at school. We are told that we can't send the excess food home with our children. Now, that's a tragic irony that we have hungry children and hungry families, and we're throwing food away because of some issues around carrying the food home. We need to find a way to deal with that. We ought not be throwing food away if we have hungry children. And I know, and I can tell you, that many of our school cooks, despite that policy, and despite the potential for getting in trouble, pack up food and send it home with those students. So we need to find a way to address that issue as well. Once again, I applaud the work of this committee, stand in full support of this piece of legislation. Thank you.
Thank you for your passionate efforts in this area. This is near and dear to my heart. My name is Richard Goff. I'm the Executive Director with the Office of Child Nutrition at the West Virginia Department of Education. I'm so pleased to hear our board president's support and Dr. Ferris's support. And actually, I'm ready to hire Bob Brown for his comments. I couldn't have said it better myself. I want to talk to you about our office and what we've been doing. And I really appreciate the opportunity to work on this piece of legislation with your staff. They're unbelievable, your three members of your staff that I had the opportunity to work with. We administer child nutrition programs sponsored by the United States Department of Agriculture, and we feed children. Every time we feed a child, USDA reimburses us to reimburse that sponsor, sends money to pay for that meal, for food, labor, and supplies, and the cost associated with that meal. We do that at our office in a variety of settings. We have basically 4 federal programs that we sponsor. Most notably is the school breakfast and lunch program. And they serve meals in public schools, 695 schools across the state of West Virginia, private schools, residential institutions. We have after-school snack programs, and we have a farm-to-school initiative with that program. So that's the first program. The second program that our office sponsors is something called the Child and Adult Care Food Program. It's the mirror image of the National School Lunch Program, except those meals are served in a child care setting. Independent child care centers, we have almost 500 daycare sites that we fund, breakfast, lunch, snack, and supper. We have Head Start centers, family daycare home sponsor providers. We have at-risk supper programs that we fund. We also, that's the second program. The third program is the summer food service program, and that is a program that feeds children during the summer months and acts as a safety net for those children when they're most at risk during the summer months. And the last program is relatively new and sponsored by USDA, and it's something called the Fresh Fruit and Vegetable Program. That program, last year we spent $2.1 million serving free fresh fruits and vegetables to elementary school children throughout the state of West Virginia. Almost 60% of our total student population are needy, meaning they qualify for free or reduced price meals. Many of these students start the school day with a multitude of problems facing them and disadvantages toward learning. Many come from broken homes where they only have one or no parent. Many come from homes that do not have medical insurance or proper care. Many come from homes where there's domestic violence or drug use, and that's the norm in the community. Many come from homes where there may have been a drug bust or a meth bust the night before. Many come to school that are sick. They don't have the health care, but we have the school nurse, and that tends to be the first line of defense for some of these children. And most of them, most of the 60%, come to school hungry. Many of the problems facing our students we can't intervene in, but we have child nutrition programs, as I just mentioned, set up all through the state of West Virginia. At a minimum, we need to feed the kids when they hit the school door. And that's what I'm so proud of this legislation and what it does. It gives, we need to make sure that these federal child nutrition programs are accessible by our students so that we get the children into school, we feed them, and then get them ready to learn. At a minimum, that's what we should be doing. We've implemented a lot of initiatives over the past 2 to 3 years, and Dr. Ferris mentioned several of those. But, and several other speakers have already touched on what research shows. But the FRAC report, the Food and Research Action Committee report, stated that children who eat breakfast at school have increased standardized achievement test scores, improved attendance, reduced tardies, improved academic, behavioral, and emotional function, and improved nutrition. Now, last year, our office, just in the public school sector, we served 18 million breakfasts. Last year, just in the public school sector, we served 32.3 million lunches. And some of the data that we distributed to you, if you look at the range of participation rates, we have some counties that on average feed 20% of their children breakfast. We have some counties that feed 80-some% of their children breakfast. As far as lunch, the participation rates range from 51% to 84%. But on average, and this is the disturbing fact, is that on average, we're 60% needy, and last year we fed, on average, 36% of our children breakfast. We have 60% of them in need and are at risk, yet we only fed 36% of them. So we need to at least meet the needs of the hungry child, the poor child, the working poor, the free and the reduced priced child at the school level. We have the programs in place, we've built the schools, we have the cafeterias, we've purchased the food, and we've employed the cooks. And all that's paid for. All we need to do is serve the child. Now, why aren't we serving children in West Virginia? This is why. Why does one county have 80-some% of their kids eating breakfast, while another county only has 20%? That's the question of the day, and it deals with access. See, if we were in business together in the private sector, and we decided to have a restaurant where we serve breakfast, and it was going to be in school, and we got together and we said, well, let's have a breakfast program. When do you want to serve breakfast? Well, let's pick the worst possible time of the day to have the breakfast program, and that's at the beginning of school. When the bus is arriving, the students are arriving, the tardy bell's ringing, kids want to talk to their friends about what happened the night before, so breakfast competes with all that. These initiatives that are outlined in this piece of legislation takes care of that issue. It allows children to come into school and have programs such as grab-and-go breakfast. They can take it with them to their classroom, or they can take it somewhere else and have breakfast. They can have breakfast in the classroom. In Mason County schools, they have an unbelievable breakfast in the classroom program at the elementary level. That's why their breakfast participation is 84% last year. And then, let's see, grab and go, breakfast in a classroom, or breakfast after first period. Why don't we get them in school, get them settled, then offer to feed them, and then meet their basic human need of hunger and get them ready to learn? That makes more sense. And if we do that, we will take huge strides in curbing childhood hunger here in West Virginia. We have the programs in place. The West Virginia Department of Education has an Office of Child Nutrition staff of 26 individuals. These programs operate. We just need to focus on getting those meals to the children. The bill, I want to talk briefly about the fiscal implication, the fiscal note, and I think we put one together. This would have no impact on additional state funds. There would be none required. It's really hard to put together a fiscal note because it's based on projections and hypotheticals, but this is basically the way it works. Every month we make a claim to USDA for federal reimbursements for these programs for meals served to children that qualify for free, reduced, or paid meals. And there's also, if the child is non-needy, there's a little bit of local collections associated with those families that are billed for breakfast and lunch that have the ability to pay. The doctors and lawyers' children. So we have USDA at the federal level with an unlimited supply of federal funds to feed children in West Virginia. All we need to do is feed the children and draw down the federal funds. Last year we distributed in excess of $100 million in West Virginia federal funds to feed children. And that sounds like a lot, but if you look at the breakfast participation statewide, it's hovering around 36%. We need to work on access, and that's what this bill does. But to give you an example of, I ran a hypothetical, and if we implement these strategies mentioned in this bill, and we increase breakfast from 36% to say 66%, and that's so achievable. That's just a 30% increase. And say we increase breakfast participation by 10%, which is easily done. It's $12.7 million in additional federal revenue from USDA that we would bring into the state of West Virginia to help feed children. To me, this bill goes a long way. It's the first of its type. I've been doing this for 23 years. This is definitely a game changer for the children in West Virginia. It's the first time in my knowing that we've had the ability to partner the private sector with government and help subsidize these meal programs that are already in place. We've had instances over the past years and my tenure where we've had grants sent out to specific sponsors, but we've never had the marriage of the private sector or public contributions or industry with child nutrition programs. So West Virginia is taking a huge step forward. I don't think this could feasibly, if it proves to pan out like we're anticipating, be a model for other states where we partner with the private sector. There's a lot of folks, a lot of businesses out there that want to lend a helping hand, and this creates the avenue to accept those funds and earmark those funds for the programs or the county or the school that need those funds. So I applaud the committee for taking up this legislation, and I thank Senator Unger for his passion on this.
Members of the Senate and those in the audience, thank you for the opportunity to speak to you perhaps for just a few minutes. I too want to add my word of thanks to all of those who have spoken before. I was particularly interested in Deacon Todd's comments, and note that he was here last week to give those comments, and it may be even more appropriate that we were able to hear from him during Holy Week. It seems to me that a couple of the questions, particularly those from the last several questions that were asked, sort of went to the issue of why do we have continuing poverty in West Virginia. And I would just throw out in maybe a very, very briefly, while I'm complimenting the committee for spending time going around the state and hearing from people, I think it's very, very important that that you feel good about what you're doing, because you're taking a message to people who really are concerned about their communities and what's going on. And so, you know, I wouldn't, I think a lot of the value is the fact that you're reaching out and you're showing that you're interested and showing that you care. I think a lot of the questions really have gone to the issue of why do we continue to have such overwhelming poverty in West Virginia. We're fourth in childhood poverty in the United States. We're one of the only states in the nation that is almost certain to lose a congressional district as a result of the 2020 census. That's U.S. Census projection information. And I would respectfully suggest to the committee that poverty is a symptom of economic health, and that we really do have time within the life of our state to take a look at the issue of the cause of poverty. I think a lot of what we're talking about is treating symptoms. And I'm not at all, I want to be really, really clear, I'm not at all opposed to treating, obviously we're going to have to treat symptoms. We want to treat symptoms. We don't want to be fourth in childhood poverty. We don't want children going to school hungry or coming home hungry or being hungry on the weekend. Our immediate past governor was fond of saying what the working people want most is a good place to go to work. And I can't help but draw the connection that when we have the lowest participation in the workforce among our population and the lowest female participation in the workforce within West Virginia, that is not because our West Virginia people won't work. It is not because they're lazy. It's not because they are unable to work or dumb. It is because they don't have a place to work. And I think that almost immediately takes us to what does it take to create an environment that attracts employment, that attracts a good place to work? I would suggest that those factors include the cost of doing business. Things like uncertainty and risk scare off employers. Instability scares off employers. Employers want to be sure that when they have issues, those issues are heard fairly. And the quality of our schools is very, very important to people who are both creating jobs and bringing jobs and have the potential to bring jobs to West Virginia. Everything that I have heard about the program that is being described makes me want to be a big part of it. I compliment you for going down this road. Those who are really experts and know about this have already testified that this is a good idea and that it will work and that it's needed. What I can sort of add to the conversation is that within the West Virginia Chamber of Commerce, we have businesses in every county in West Virginia. The businesses that participate in the West Virginia Chamber employ over half of West Virginia's private sector workforce. These are the people who regularly provide scholarships and support to our colleges and universities. These are the people who show up at the public schools to help with all those things that that parents and caring adults can bring to the table. And they are telling us that they are eager to help support a project that helps our children have what you're trying to accomplish with these hearings and with this bill. And so